So welcome to those who've joined. We'll just wait just a few more seconds as the numbers go up. And then we'll get started. Okay, so let's get started. So greetings, ladies and gentlemen, and welcome to this session on If You Value Water, Value Sanitation. And we hope that you'll leave the session with an added appreciation of why and how we need to value sanitation. I'm Juliette Willits. I'm a professor and research director at the University of Technology in Sydney, and I'll be the session moderator. The format of the session is a brief framing that I'll provide, followed by three main speakers who I will introduce in turn. And we'll then have a panel discussion moderated by Barbara Evans. And finally, Guy Howard will make some closing remarks. So moving to the framing. Sanitation comes indirectly into this year's conference theme, in that when we value water and its importance to us, we'll look to pollute it less. And that's where we come in. And this is critical, as if we value water as a resource for human use to drink and for industry, for its inherent worth, for recreation and as a public good, then we must value sanitation. And the value of sanitation is that it deals with issues upstream before they become a problem, protecting health, ecosystems, avoiding disease outbreaks. It's a preventive measure rather than allowing symptoms to arise. And in the case that we have poor sanitation, inevitably we reduce the value of available water, whether it's open defecation reaching surface water, inadequate containment reaching groundwater, emptiers dumping sludge into waterways, leaking pipes, or overloaded treatment works. We need safe management for the whole sanitation chain and whole urban areas, including dense informal settlements. But what do we know about the interactions between sanitation and water, and how might this knowledge help us define the kinds of improvements we need to make to sanitation and that we need most? And here I'll just share very briefly some current thinking and research about these. So starting with groundwater, there's literally thousands of papers dealing with the links about how bacteria and viruses can reach groundwater from different types of sanitation systems. But in examining this evidence base in detail, which we've been doing, the evidence is actually quite mixed, and in part because there are so many other sources of contamination to wells and boreholes. And from this literature, there's actually no magic setback distance where you can safely site a well from a sanitation system. And that's because it depends on so many factors, on the density of systems in an area, on the soil conditions, and recent evidence shows that when we have additional rainfall, pathogens are mobilized much further, and you end up with worse contamination in wells. And that's something that's a real concern given climate change and the increasing frequency and intensity of rainfall events. So whilst in perfect conditions, maybe you can have just a 5-meter separation, but perfect conditions rarely exist. And hence, where we have shallow groundwater and it's being used for domestic purposes, really we need to be shifting to sewerage, whether that's centralized or decentralized, or shifting to piped water as a priority for drinking. And the latter may be more economical. And although we've known about this issue since 1854, long ago when there was the cholera outbreak in the UK, still many people in different countries are using shallow groundwater in urban areas. And that includes some 49 million people using it in Southeast Asia. Fortunately, our research methods to better understand risks are improving. And there are methods now such as source tracking, where we can understand where pathogens are moving using their DNA. And as we better understand how they move, and in particular how the biomat that forms around a tank or a leach field works, and the treatment processes in soil, we may be able to optimize the use of sanitation systems. And then moving on to surface water. So the latest report from UN Water on the proportion of wastewater treated, so SDG 6.3.1, we find that only 25% of wastewater is treated in Central and Southern Asia, with similar figures in Sub-Saharan Africa. And that's because on-site surface waters, on-site systems are set up to areas and in catchment areas is an increasing problem. But here too, there are many new research methods and ones that are able to look at water quality. So not just remotely monitoring water heights or water flows, but actually also water quality. Also satellite data, sentinel data is able to understand aspects of water quality, and drones are able to take samples. And also a more recent method that's being employed as part of citizen science is communities looking to understand their water quality near where they live and trace problems upstream to where they may need to be dealt with. So then if we move on to a final slide, we have a poll for you here. And so we'd like you to go back to the Pathable platform, which is the browser that you came through to get into this, this session. And to think about, in your context, what do you think are the 3 highest priorities if we're to value sanitation? And some of these different points that we have here, different speakers are going to touch on, whether it's household behaviour, whether it's about how we balance investments in sanitation versus water, whether it's how we look at how we integrate sanitation into emergency disease response mechanisms. So please move to the poll, and we'll have a brief look at the responses that come through. So you need to click on polls. So there's a chat and then there's polls, and then it asks you if to value sanitation in my context, the 3 most important are, and you can choose whichever 3 are most relevant to you. So at the moment, we have the highest vote on increasing human resource capacity, the right skills, but also many people who think that we should be treating it as a public service in urban areas. So again, the human resource capacity is still leading, and a tie between the first couple and the last, which is about enabling and regulating safe reuse of wastewater and fecal sludge. Still more responses coming in, but still we have the leading one is on human resource capacity. So that's very interesting, and you'll be hearing a bit more about that in our panel conversation. So with that, we might then move to our 3 speakers. So I'm really delighted to introduce you to our first speaker, who is Mrs. Trewi Dewi Vidigianti, Director for Housing and Settlement in the Ministry of Development Planning, Bappenas in Indonesia. So Mrs. Bivigi has spent more than 24 years working on Indonesia's policy development in areas of urban development, housing, settlements, climate change, and environmental management. She holds a Masters of Environmental Management and Development from the Australian National University. So Ibu Bivigi, I'd like to then hand over to you. Welcome.
Thank you, Juliet. So glad to be here on time. So thank you very much. So as Juliet said, I will present on the Indonesia Urban Sanitation Campaign. As Juliet said, if you value water, the theme of this World Water Week is if you value water, you have to value sanitation. But I think, again, the same with the reality globally, we more value water than sanitation, yeah, because we use it more. Maybe you can see it directly, but for sanitation, if after you done your things, you don't see it. I mean, and sometimes we don't care how it was treated. So it also, again, this similar to Indonesia, how the people behavior towards sanitation. We value maybe less compared to water, yeah, about sanitation. So the access of sanitation, although although the access to safely managed sanitation in Indonesia, not safely, but improved sanitation already increased significantly from 2011 or maybe 10 to 20 years ago to now. But the access for safely managed sanitation is improving very slowly, yeah, especially the last 5 years. So we have safely managed sanitation rate at the moment is 7.25, and this one is decreasing from what we have in 2020. So what that's also trigger us to do more, because one of the aspects that I always highlighted to have a good services of sanitation is demand of the people, demand creation, or how people see the sanitation, whether they want to connect, whether they want to pay connect to the services, and whether they want to pay, a willingness to pay for the services as well. So one beside of course the infrastructure, the institutional arrangement, the regulation, as well as the financing. So one of the most important aspect is also the people, how people see the sanitation. At the moment, also more than 70% of households in Indonesia use water that are contaminated by E. coli. This based on our recent survey in 2020, because we want to have a baseline for safely managed water. Actually, we do this safely survey, and we find not surprising reality, but still alarming for us that this is happening. And then, of course, stunting is also still significant in Indonesia. This also maybe because one of the sensitive aspect or sensitive cause is poor sanitation as well as water access. Yeah, poor sanitation and water access that is still improved, not yet safely managed. So diarrhea is one of the 5 main causes of under 5 mortality and also stunting. So it's very logical. The water that you drink is contaminated, and then sanitation is also contaminated. Your hands and other things surround you that also gives consequences on still a significant rate of stunting in Indonesia. The open defecation is also still around 5%, so it's a lot of number compared to our population. So again, this is something that we need to really address. One of the aspects, as I said, is the demand from the people, their willingness to pay, willingness to connect to the good services. So how to this one is also a reality where how sanitation impact our water quality. As I said, 82% people using water that are contaminated by E. coli because of one of the causes, of course, the sanitation that we still rely on, the on-site sanitation based on septic tank that maybe or 70%. Most from the of the septic tanks that we have is still not the standard one or not the quality one. So again, that's also things that we need to address. So if you want to change the septic tank, if you want to replace with the good standard of septic tank, again, you need to talk with the community, whether they are willing to change that, because it's already built, it's already in their house. They might not be willing to change it, replace it for some time before they really know the benefit of it. And the benefit is sometimes very long or long term. They cannot see it directly. But again, this one is, we need to raise the awareness about this, we did some of the campaign. So again, campaign to increase the awareness, public complaint. It's also there's also some community engagement mechanism, make the community aware and change their behavior, a motivator for the behavior change. So, but again, Indonesia culture is very soft. Yeah, I mean, you cannot say something frank, so frank, gitu ya. But there is from what we research with the help of UNICEF and also other partners, that we need something that really catch the eye as well as the ears of the community. What kind of terminology that we use will really influence the effectiveness of the campaign, something like that. And also the way we do it, because now there is a digital information, many social media, they are talking in digitally. So that's also our target. But also, again, the language that we use, I'm from the old generation, you can say that in Indonesia, but we have a more younger generation that quite dominant in the way we influence our behavior, that use different language. So we're trying to find the best language to really or to catch their eye, catch their ear. So that's what I ask. But again, as an old generation, I don't agree actually at the beginning on the use of the language. We use it, Thai. Thai is very rude sentence in Indonesia, rude word for Indonesia. But for younger, it's very catchy, and they really not like it, but it encouraged them to, oh, okay, it surprised them, oh, we still have this problem. So again, the language is also very important. So of course, it's based on the research, but that's not only one. But we are also have another way of approaching for campaigning. We see that neighbors is very important. You see your neighbors, then you change your. If you see your neighbors do something better, do something good, or have more benefit, you may copy them. So neighbors is also very important. Consider of capable of being motivated behavior for change of peer, yeah, change of other neighbors. So again, we also have this kind of campaign for WASH. There are two big campaign that we release. One is Check It Out Squad, the one that used that very rude word actually, and then Good Neighborhood that initiated by USAID with the central government as well as the local government. And Check It Out, or the other one is we initiated by UNICEF and the WASH working group in Indonesia. The main message of the campaign, of course, triggering, as I said, catching the attention of the people. This is still a problem, and then we explain it why it's still a problem and how important is safe sanitation for the people, and the impacts of unsafe sanitation. And then sending the message as well that make sure that the household has a toilet, that septic tank that is standardized, and then they have to they sludging the septic tank one time at least regularly within 3 to 5 years. And we also have a contact if they still need information and so on. So the campaign result so far is very, it's surprising to me, because we have a criticized as well on the word that we use on this Check It Out campaign, actually. Yeah, but the result is very good. There are 250,000 visitors. It's a big one, and it's quite viral at that time when we released the campaign. But again, this and then for the good neighborhood, it's also triggering decrease in open defecation and sale of the toilets, and the reaching out of the good neighborhood campaign. But again, this campaign cannot be done just once, so it needs to be done continuously. If you want to advocate people, you have to do it regularly, consistently, and in the long term. So we cannot just do it once. It needs to be done again and again, just to remind people, because people forget easily about this kind of thing. Thank you. Maybe that's all, Julia. Thank you very much.
Great, thank you so much. That's amazing to hear. And we're going to just watch very briefly an excerpt from the campaign. Thanks, Freya.
Indonesia sedang terancam.
Coba rewind. Stop. Kita harus siap-siap.
Guys, ternyata dia mengincar kita semua, dan terutama anak-anak.
Kalian harus lihat ini. Dia nggak cuma muncul dari air, tapi juga lantai yang kita injak.
Jadi, dia sebenarnya ada akibat perbuatan kita. Dari septic tank yang nggak pernah dicek dan disedot.
Kita harus bergerak sekarang.
Jangan gegabah, Pak. Kita nunggu.
Mau nunggu sampai kapan? Sampai keluarga lo kena? Sampai semuanya mati?
Oke, Kim. Masih ada harapan untuk kita menyelamatkan Indonesia dari dihantui tai. Cek caranya di cekidot.org.
There you go. So that gives everyone a little bit of an idea about what the campaign is like. And thanks so much, Ibu Bidigi. So if anyone has questions for Ibu Bidigi, please do put them in the Pathable chat, and Barbara will be able to use those to share with Ibu Bidigi during the panel session. But for now, we'll move on to our second speaker. So Qazi Matin Ahmed is a professor at the University of Dhaka. He's a leading researcher on groundwater in Bangladesh, and his work focuses on the impacts of urbanization. He has a PhD in hydrology and water resources science. And with that, I'd like to ask you to jump in. Thanks, Professor Ahmed.
Thank you very much, Juliet. Can I change my slides, or you will do it for me?
We have a support in the background, and you just need to ask her to move it forward. Yeah.
Okay. Yeah. Thank you. Okay. So thank you for the introduction. And I'm going to talk about basically Dhaka. But before I move to Dhaka, I can give a very brief overview about Bangladesh, what has happened. Open defecation was once a very big problem in Bangladesh. This has been reduced significantly, and currently very few people use that. And also, there has been a systematic switch to groundwater as a microbial-free safe of water, and that remarkably reduced the under 5 child mortality along with other effects. So all over the country, the situation has improved significantly. The use of on-site sanitation has increased in rural areas as well. But when we come to Dhaka, the problem is a bit different. The magnitude is very big. So what are the problems in Dhaka? I will focus mainly on that. This is the fastest growing megacity of the world, more than 20 million population with about more than 3% annual increase. And about 20% of the inhabitants live in more than 5,000 slums. And that is one of the major problems in terms of sanitation and safe water supply in Dhaka. The numbers are increasing from the coastal zone as climate change impacts are very much visible there. Only about 20% of the city are covered by pipe sewage network, and rest use on-site sanitation or very other things. Next slide, please. So what are the major challenges in Dhaka city? The city dwellers generate more than 2 million cubic meters of wastewater every day. Until Last year, there was only one sewage treatment plant, the Pagla STP, with a capacity of about 120,000 cubic meter per day. Recently, another one has been built, the Dashkandi STP, with a capacity of 350 cubic meter per day. This is not fully operational yet. So combinedly, these two can treat only 25% of the swell. And most of the wastewater flows to the surrounding Buriganga, Shitalakha, Balu, and Turak rivers and other water bodies. Next one, please. So what is happening to the rivers? That is the main. So the rivers has become the filthy sinks, receiving all the untreated wastes from the city. Only 20% or 25% is being treated. So what are the impacts? It's impacting the soil, impacting surface water quality, impacting groundwater quality and air quality, and posing serious public health hazard risks. And most of this is linked to what has been discussed earlier by Julia and also by our colleague from Indonesia, is linked to the poor sewage and sanitation condition. So the Dhaka was built on the river Buriganga because of its good quality water sources. But nowadays, if you see a river like this is not water, this is full of filthy stuff. And most of the, about 70–80% of the water ends up in these rivers. Next slide, please. So situation is really bad. So what is being done, or what is needed to be done? So if you take the risk-based approach, so if we cannot improve the sanitation situation, we cannot improve the water quality, we cannot improve the soil quality, we cannot improve the air quality of the city. What are the challenges? The main challenges are there are so many actors involved in different aspects of water management. That is one issue. Water supply and sewage authority, the Dhaka Wasa, they are responsible for water supply and sanitation. The city corporations or municipalities, they are responsible for storm drainage. Then Bangladesh Water Development Board, they are responsible for monitoring surface and groundwater resources. The Capital Development Authority or Raju, they are responsible for managing land use and urbanization, which has close link with all these urban water management issues. Then Department of Environment, they are responsible for regulating the quality of waste and other things. And also there is National River Conservation Authority. Their main target is to protect the rivers. So there are some additional organizations. So this is a major challenge. There are so many actors and there is lack of coordinated effort. But good things are being done. So 3 master plans have been made: the drainage master plan, then the water supply master plan, and sewage master plan. So drainage master plan was initially supposed to be implemented by Dhaka Wasta, but last year the storm sewage management has been shifted to the city corporation. So it will be now implemented by the city corporations. The other 2 plans are being implemented by Dhaka Wasa. So what is important, if we would like to ensure good quality water supply for Dhaka city under this master plan, as the target is, we have to make sure that there is a co-management in place which will take care of this water supply, sanitation, and sewage, and also storm drainage. So instead of 3 different master plans, it would have been better to have an integrated strategy or master plan, and then coordination. This is a major challenge. So we need a very good coordination for implementation of this integrated strategy or plan. And for doing that, there are so many agencies now. So we need an agency with enough legal power and technical capability to steer all these actions. So I think that was my last slide.
Great. Thank you so much,
you.
Professor Ahmed. Really appreciated. And we much hope that these kinds of plans to have better coordination and integration across the different parts of water and sanitation can really improve the situation in Dhaka. So from here, we'll move to our 3rd and final speaker, who is Justine Haag. She is a WASH officer with the cholera team at the World Health Organization headquarters in Geneva and the WASH focal point for the Global Task Force on Cholera Control. She's an environmental engineer specialized in integrated water resources management and WASH with a special interest in the sanitation sector. So over to you, Justine. Thank you.
Thank you, Juliet. Indeed, sanitation is my favorite topic, and it's not so often that I get invited.
Can you speak up just a little bit, at least the audio?
I think that should be better.
That is way better. Thank you so much.
Thank you, Juliet. So I'm going to make a brief presentation on the role of sanitation in cholera prevention. Next slide, please. So in terms of cholera, cholera is coming from a bacteria, Vibrio cholerae. It has its natural habitat in Southern Asia. It slowly made its way to Europe, where it was prevalent until around the 70s. Around the same period, it migrated through the hosts to sub-Saharan Africa and the Americas. Currently, we have seen that it's on its way of elimination from the Americas. It's not present anymore in Europe, but in sub-Saharan Africa and Southern Asia, it is still endemic. As you can see on that map, it's a map from 2021. We have various countries which are still affected with cholera case reported. 2021 was a bit of a special year with a very large multi-country outbreak in Western Africa, the largest that has been observed in over 10 years. And 2022, unfortunately, also has seen a lot of outbreaks so far. We're almost in September, and we have more than 25 countries with outbreaks. It started early in the year with Southern and Eastern Africa. We have currently also outbreaks in Southern Asia and Central Asia, the Middle East, and so on. So not a very good situation so far in terms of cholera. Could you please go to the next slide? As we can see here on this graph, you have the data plotted for the reported case and case fatality rate from the late 80s to 2020. We can see that 2017 was a record high. We can also see that as of 2020, there was a potentially a positive impact of COVID with infection prevention and control measures in place that led to a reduction of cholera spread. Unfortunately, this situation has been reversed as of last year. And of course, we can see also a good thing that the case fatality rate trend is decreasing, which is good news. But we have to remember that globally, cholera cases are underreported, so we can assume that there's a gross underestimation of the case and the death from the disease. Next slide, please. So cholera is a waterborne disease. It's coming from a bacteria. It's spreading through various pathways. The first one is through feces. So of course you are affected by cholera and you will shed it. So the first and primary barrier to contamination is sanitation, as you can see it. So either it will then leak into water bodies, it will be in the fields when it's used for agriculture, sludge is used for agriculture, it could be in households, it could spread through flies or hands. And so we can see that water treatment or hygiene are only secondary and tertiary barriers to contamination between the primary and the secondary host. Next slide, please. So in 2017, the Global Task Force for Cholera Control was revitalized. It was mainly something that was led by the fact that vaccination became largely available in 2017. It is, as of today, I would say a partnership or a network organization with around 50 institutions, global, national institutions. So a wide range of actors from the health and the wash sectors. Its two main components are the GTFCC Secretariat, hosted at WHO. I'm part of that team. And a newly established, as of last year, country support platform, which is mostly present in country to assist the development of national cholera control plans, and it is hosted by IFRC. The country support platform is, as of today, present in 4 countries: DRC, Zambia, Nigeria, and Bangladesh, and we have good hopes that a similar structure will be established in Mozambique in the coming few months. Thanks. Next slide. So what is the strategy that is working for the GTFCC? First, of course, a commitment of all stakeholders. That's our input. Many organizations uniting their forces to eliminate and control cholera. We have 3 main axes of work. One is to react very quickly to cholera outbreaks in epidemic setting. The second one is to identify cholera hotspots where cholera is endemic and prevent it and eliminate it through the implementation of national cholera control plans. And of course, the establishment of a very strong coordination mechanism, joining forces in terms of technical and financial assistance. Our target goals are to eliminate cholera from 20 countries. There's around 50 countries reporting cholera as of today by 2030, and also to eliminate uncontrolled cholera outbreaks in fragile setting. Another very important indicator is to reduce fatality rates or death by cholera by 90% by 2030. Thank you. Next slide. So the strategy is developed around various pillars of interventions. We can imagine that this is not only a health issue, but also a wash issue, and it goes beyond with financing of all those measures. So we have various pillars. The first one, in our case, of course, is always wash, but then surveillance, very important, knowing the disease, where is it? OCV to try prevent it. Unfortunately, even double vaccination only gives a protection of 5 years. And then we have case management through healthcare strengthening and a stronger coordination between all actors at national level mostly. Next slide, please. Good, thanks.
Great, thank you so much, and really important for us to learn about where and how sanitation fits in that wider world of cholera prevention, and good to see water, sanitation and hygiene as the first pillar. So from our 3 speakers, you've heard about behaviour change as a way to value sanitation coordination, and also how it fits in with emergency responses to a particular disease. So from here, we'll move to our panel discussion with our 3 speakers. And I'd like to introduce our moderator, who is Professor Barbara Evans. She's a Professor of Public Health Engineering and a Chartered Engineer with a 2nd degree in Development Economics. She holds the Chair of Public Health Engineering in the School of Civil Engineering at the University of Leeds, and works on water, sanitation and hygiene, but with a particular focus on urban sanitation in cities and towns. And so with that, I'll hand over to you, Barbara.
Thanks very much, Juliet. I'm wondering, Freya, maybe if we could, can you stop sharing, and then we'll be able to see our beautiful panelists in a bit more detail. Thanks very much. I think what was really interesting about these talks is you can see sort of sanitation popping up in a range of different contexts, but all around the idea of sanitation being a sort of at-source preventative intervention. Also, some of you have participated in the poll. So I want to just pick up some of the themes that came from the poll and kind of go back to our speakers and ask them a little bit more about that. So my first question goes to Ibu Virji. So you mentioned that even the terminology used in one of the behavior change campaigns was quite challenging for people. And I would say that in addition to that, the idea of sanitation being much more about behavior and governance and so on is a change for the sanitation sector. I mean, a lot of people in the sanitation sector still think that we're only in the business of building toilets, but you've clearly managed to shift the focus to two things. One is household behavior, and the other is a real focus on managing the system. So, you know, a lot more focus on emptying and taking the waste and treating it, which we all know is very important. So given the scale of your program in Indonesia and given that big shift which you've managed to achieve, could you tell us a little bit about how you went about building the human resources to deliver that program? Like, what's your reflection on the training needs and the way you went about building capacity, or, you know, not changing household people's minds, but, you know, changing the minds of professionals working in the sector?
Yeah, thank you very much, Barbara. So it's also a challenge. Yeah, I mean, when we talk about professional, maybe we more talk, I mean, in my assumption, in my understanding, it's more on technical person, right? I mean, the one who built the infrastructure or put the technology in that infrastructure. So it's like when I facing the Ministry of Public Works, maybe the one who responsible of deciding where to build the infrastructure, what technology will be used, what approach they will use in the system, and so on. So maybe, if I may say, that's the way I see it. I mean, how can I make public works realize that it's not just about building that infrastructure, but we need to do something else beforehand and also afterwards. First, of course, that's what I mean, it's challenging because they are focused on building and building and building. I mean, and maybe pay less attention on the readiness of the community, on the readiness of the local government to manage that. Because for our system, it will after the public works built, I mean, the one who will manage is the local government, not the central government or the public works. So again, they sometimes that doesn't really put much attention on the readiness of the community as well as the local government. Looking at that, at the beginning, we put like a readiness criteria for any proposal that will come to public works, for example. The readiness criteria will cover the whole thing. At the beginning, readiness criteria only focus on the physical readiness criteria, like the land availability and so on. Things like that. I mean, the access and so on. But that really never touch whether there is a demand or not, whether there is a institutional arrangement already in place or not. No. But now we're changing the readiness criteria more on more complete, covering all the whole thing, not just the readiness on the physical infrastructure like land and access, but also real demand survey. Is there any demand really there? If not, what we need to do first? Building the demand first by campaigning, by education, by promotion, and so on. So we do that. I mean, we trying to do that with the public works. So they need to wait until this one is ready before building it. I mean, so or at least we use the criteria, readiness criteria, more complete the whole aspect before we really build something. But again, but this so So we need to build the capacity of the public work as well as the one who is responsible for institutional arrangement is Ministry of Home Affairs, for example, in our country, and Ministry of Health, the one who will do the promotion in more massive way in the national level, who is responsible for that. So again, it's not easy, but we do it with the criteria. Is also now actually we want also more stringent on the approving any project, a physical project investment, like pre-FS or FS, that cover also the whole thing, not just physical feasibility, but also social, economical, and also the readiness again of the community as well as the local government. That's maybe the one how we trying to do with this kind of shifting focus, like you said, from the infrastructure to more other aspect as well. Thank you.
That's really interesting. And two things which I think are super interesting there is that, as you rightly point out, you have different groups of people, different professional groups in different ministries. They're coming from different directions to the problem. So we need to think of different strategies for building capacity. But also what I liked, or what I think is very interesting there, is you made the link between the way the program is set up, the requirements of the program, and almost like the regulatory signals that you're sending are aligned with or are part of your strategy for changing behavior. If you clearly state that certain things are required before you can enter into a project or a partnership, that really helps us to focus attention on, well, then we need to organize ourselves so that we can do those things which are required. So I really like that link between the sort of, the regulation and the training. On that note, I'm just going to turn to Professor Ahmed, because I think this question of bringing people together from different ministries, I think, is something that many of us have wrestled with. There's very different, I would say, sort of cultures in different professions and different ministries. Professor Ahmed mentioned in Bangladesh, obviously, Bangladesh has wrestled with a lot of challenges around the use of groundwater. It's had huge success in moving people from using surface to groundwater. And then, of course, we have the arsenic crisis. So we understand, I think, perhaps better than in many countries, the connection between sanitation and groundwater is perhaps more, people are more aware of it even amongst citizens. But I wanted to ask you about what's your sense of the extent to which it's possible to get water resources colleagues who think about groundwater in the same room with the people who do planning and implementation of sanitation programs. And they're very different, again, very different groups of people. Do you see any sort of collaborative work? Do you see people working together? And if you do, or if you don't, like why might that be happening? So do we see the coordination that we all long for?
Thank you very much, Barbara. These are very important points that you have raised. This has been a major challenge for us, like the different groups working within their own silos and not talking to each other very much, even in different sectors, like in Dhaka, as I mentioned in my presentation, number of different groups are involved. We have started to talk to each other, but not really we are working together yet, but we are moving towards that. So what people or the policymakers have started to understand that once and only we can solve this problem when all these groups work together. So currently there is not much control on groundwater abstraction. So outside like big cities, one can abstract as much water as they can. Also these on-site sanitations, those are the main options for sanitation in the rural areas. The impact of those on-site sanitation on groundwater are not being closely monitored. There is no control on those kind of efforts. So what I would say is the co-management of this water resource and the sanitation efforts are not well coordinated yet, but we are moving towards that. So I think that would be my answer at this moment.
I think that's probably a situation that many people on the call can relate to, a sort of willingness, some understanding, but it's kind of patchy. I want to bring in a new speaker now. You may have noticed that we have a third member of our panel, Kirsty Carden, who is the director of the Future Water Research Institute at the University of Cape Town. Kirsty is somebody who's really worked for a long time on urban water management. I think of her as somebody very active in the water sensitive cities space, and I think someone who's really wrestled and grappled with this problem that water and sanitation management in the urban space is enormously complex. I mean, we've just talked about the link with groundwater, but of course we haven't even touched on the link with urban planning, housing, land rights, tenure, and Kirsty can tell you a lot more than I can about that side. I wanted to ask you a very specific question. One of the other points that came up in the poll, and also perhaps a little bit comes from what we heard from Ibu Virji, is that we often say political will is something that we need, particularly where we're trying to drive these coordination efforts. I always have a slight feeling that political will can cut both ways. You know, it gives us some leadership, it can also perhaps create some challenges. So Kirsty, I mean, you've worked in a lot of cities and in quite complex political contexts. I wonder if you could just tell us a little bit about, you know, how do you feel political will plays out in this challenge of linking sanitation and water together? You know, when is it good, when is it bad?
Thanks, Barbara, and yeah, thank you for having me on the panel. So South Africa has quite a significantly different context, I think, to many other countries in this regard. We've got really excellent regulation and policy that stemmed from our new democracy, so into the Water Act, into our constitution, which of course allows for things like free basic sanitation, free basic water, you know, so this concept of basic public service in urban areas does exist. Well, it exists on paper. And I think that's the problem. So through our three-tier government system that we have, sort of national, provincial, local, the provision of bulk services is a national competency. It's devoluted, or whatever the word is, down to local government level, and sanitation is constantly shifted out from one ministry to the next. So it never seems to stay in one area, and it's often not aligned, bizarrely, with water. So sometimes it's with human settlements, and sometimes it's with something else. And what happens is that it doesn't allow some form of holistic management of water across the cycle. And I quite often like the Brazilian definition of sanitation in this regard, because they see it as a holistic consideration of water, sewage, solid waste, vector control, and of course, most importantly, drainage. The whole idea of wash becoming washed with the drainage tacked onto the end becomes so important. So the challenge in South Africa particularly is that we've got all this great policy and regulation, but it doesn't play out on the ground because, for one thing, the free basic services issue means that water is the main focus that gets put into settlements, with often sanitation doesn't even appear in that mix, and drainage definitely doesn't. So that you have this sort of complexity through the provision of services without protecting environmental and public health from that. And the challenges in scaling up are also associated with things like failing wastewater treatment. We do have quite good wastewater treatment if you compare us to the 7.5% of safely managed waste that I heard from our Indonesian colleague. I think generally we have relatively good approaches towards wastewater treatment, but for the same reasons in all sorts of countries, you know, resources, human resources, capacity, skills, funding, all of those things mean that wastewater treatment is also failing. And that contributes to the sort of massive urban stream syndrome, the massive environmental health and public health impacts that we're seeing. So yeah, I think I could burble on for a long time on this, because it is it is what I really feel passionately about, this, particularly the drainage issue, and the fact that policy is all very well and good, but it needs to be implemented through proper programs of actually considered holistic management of water and sanitation services. Thanks.
Super interesting. I think that's music to the ears of many people. I kind of wish I could see more people on the screens, because I'm sure they'd be nodding along. Kasi, I'm nodding on behalf of everybody. So I just want to also pick up, before we go back round the panel, so we've sort of heard about the challenge of changing behaviours, the challenge of bringing different sort of ministries and communities of practice together, the challenge of sort of converting policy or sort of written, into the messy reality of cities, who are struggling with all sorts of needs. And then just to sort of remind ourselves, we heard from Justine, of course, that sanitation also plays a role in the control of epidemic disease and in emergencies more generally. But one of the things that I think is very interesting, Justine, about your presentation, I mean, one very striking thing, which I'm sure many people noticed, is that even though we see outbreaks of cholera persisting, and as you said, 2022 has been a particularly bad year. Of course, death rates, the case fatality rates, are falling, and crudely, I would argue that that's the symptom of something which is that we focused a lot on improving the treatment and care of people who get sick, but we still haven't managed to sort of embed perhaps a concept of sanitation as one of the most effective sort of preventive health interventions. And I just wondered, in the cholera task force, one of the things that perhaps I imagine might be happening is that you have a tension between emergency international response and much longer term interventions, and it's quite difficult to make that conceptual risk. It's quite difficult to say to a government, this intervention to improve access to sanitation is actually buffering you against a hypothetical future outbreak. So I just wondered, Justine, if you could tell us a little bit about what the International Global Task Force, or you yourself, think are the prospects for sort of having active management of sanitation and water services sort of really embedded conceptually as part of the international emergency response thinking. How easy is that something that gets talked about?
Thank you. It is indeed something that gets talked about, but I so far failed to see its real manifestation on the ground. I mean, sanitation is the poor kid of the triad. Water supply is very well known. It's something that is attracting a lot of attention, a lot of funding. There's a lot of capacity. Hygiene promotion is often left to the people themselves. We speak a bit of soap and little access to water for hand washing, but sanitation, it's very technically very complicated, also very interesting. It's underfunded. It's not selling as well. And this is a problem not only to reach SDG 6 in development work or in simply in how to manage the sector, but it's also a problem for emergency response and preparedness activities. We can see that humanitarian responders are oftentimes providing very quickly water trucking, water treatment. In an acute crisis, it can last several months until you get latrine slabs delivered in the conflict zones or disaster affected areas. And we know latrine slabs are not the solution. This is just a user interface. So there is a tension here. And I think if we want to really think of cholera elimination, we need to think long-term. So we need to put ourselves in the framework of the SDGs, or maybe a lesser level of performance, but certainly we need to talk more and in the depth of how to improve sanitation systems, including going from the user interface to the treatment, the final disposal, talking about regulation, talking about laws, talking about institutional arrangements. Why is it scattered throughout so many ministries in each and every country around the globe? So yes, sanitation is certainly the solution, because it's also the root cause, and we should put more emphasis on it, certainly in national cholera control plans, and link them with the WASH sector strategies and plans at national level. That's for sure.
Thank you, Justin. It's so lovely to hear you saying that. And I have to say I'm going to claim, along with Kirsty, perhaps a little bit of a sort of old age card slightly, I do feel, and I mean that positively, Kirsty, I do feel, I can personally feel a little bit of a shift. I feel like, the fact that we're talking about sanitation in this conference, which doesn't have sanitation as its focus, the fact that, as you say, it's possible now in a global cholera task force for a service intervention like sanitation, a preventive service intervention, to be genuinely on the table alongside, vaccines and drugs. That does feel encouraging to me. I want to just go back to Bangladesh for a moment, and then I'm going to go to South Africa and Indonesia, and just ask you, Professor Ahmed, a little question. So one of the challenges that I see in sanitation, and I think you can get a sense of this from the Indonesia campaign, is that if we do sanitation really well, it disappears. And it's always been one of my theories that that's one of the reasons why it's undervalued by politicians, because it's a sort of negative service. If it works really well, everybody forgets that it exists. And then they get a bit sort of fed up that they have to pay for it and, get involved in, managing it or calling for the truck guy to come and empty or whatever. And in the UK at the moment, we have a genuine problem that we can see now the evidence of sort of 20 years of chronic underinvestment. And I would argue that's partly because the sanitation was working really well, people stopped prioritizing it. So I just wanted to ask you, Professor Ahmed, what's your sense of how visible sanitation is as an issue amongst people generally in Bangladesh? So therefore, does it translate upwards into the political domain as a visible issue? And is it, it should be visible, right, in a country like Bangladesh, in a city like Dhaka, because you can see it on the streets, but is it something that people care about?
Yeah, but I would say it's becoming more and more visible. So there are a lot of movements, like in the rural areas particularly, there is like community-led total sanitation movements, and those kind of issues are being in place. And what is the problem in Dhaka is like it's a very big problem. This needs big investment, needs big coordination. But in the rural areas are doing good actually. Like as I mentioned at the beginning, that this open defecation is almost nil. Then we have this on-site sanitation, which was not there. Like we have all had kind of, when I grew up, it was all kind of open defecation or open latrines. Now you don't see that anymore. Then there is a strong NGO movement. There is strong civil society movement towards achieving better sanitation coverage. So it's becoming more and more visible. Investment that is needed. So still more emphasis is given on the water supply. So the sanitation should have a better share of this investment. So that is what I would say at this moment. So my main point is that it's becoming more and more visible in Bangladesh.
That's encouraging. It definitely needs to. Kirsty, I want to pick up on this sort of distinction between rural and urban, actually, because I think in areas where it's possible to sort of manage close to the house, and we can think to some extent about sort of household action has an immediate sort of visible positive effect, but that's much more difficult in an urban space, obviously, where I would argue it's almost not a household issue. It's really, a municipal services issue. To what extent do you see, any sign of a shift where sanitation is really seriously embedded in, conversations around water sensitive cities and sort of, and as you said, this idea that you rightly said that drainage is, sanitation is the poor cousin, drainage is the orphan, abandoned child left right outside. Do you see any sort of positive changes at the moment?
Yeah, it's a difficult thing. So in rural areas, potentially we're getting to a sort of sanitation sensitive space because we have the options of dry sanitation and urine diversion and those sort of different options that are gaining somewhat of a momentum, particularly in areas that have done the background social engagement work, because of course toilets in this country are also used very much as a political tool, a political weapon to try and gain votes for certain parties and generally talking about toilets in informal settlements. becomes very politically motivated. So I mean, I think it is starting to pick up in cities and in urban areas around, in the context of discussions on minimization of waste, on resource recovery and the circular economy, low flow toilets. There's a lot of work that's happening through our Water Research Commission in this country, trying to really promote that sanitation sensitive space that sort of fits into the water sensitive city. So I think it's happening, but still needs a lot of work. And those links, you know, that you talked about now between sanitation and public health. Why on earth it's taken us so long to keep talking about this? You know, I mean, our very first slide here was that in 1854 or whenever, you know, they showed the link between public health and sanitation. So yeah, I guess we just have to keep talking and talking and talking.
Yeah, no, that's really interesting. I always reflect on the fact that, I mean, I was trained as, it's a very old-fashioned title, but my original degree is in civil engineering and tropical public health. I mean, and I hold a chair in public health engineering, and I'm often told, what a strange job description. That sounds very old-fashioned and boring. And I'm always saying, well, actually, public health was, I'm sorry if you find it boring, but it's kind of what we need to do. Which actually brings me to Justine. And I just wanted to ask you a little bit, Justine, about specifically that, actually, the extent to which at the global task force level, or just more in your experience, you know, with your sort of coming in with your engineering background, do you feel, or what do you think about the sort of fact that some of this work is really technical? So, you know, there's always a sort of, you know, it would be lovely to think that we can do these things in a sort of do-it-yourself way, you know, and people can take action and change behavior, and that would be enough. But obviously, some of the sanitation interventions are complex. They're complex to build, but in fact, much more complex to run. Do you find engineering conversations are sort of present in the conversations about cholera response? How do you feel? Just, you know, how do you feel about the status of the sort of technical tackling of these problems in the debates that you're part of?
I wouldn't say that sanitation is really at the center of the global discussions around cholera. Certainly, if you talk to other WASH practitioners, it will be mentioned. But I'm personally trying to really to put the spotlight on sanitation, also to see what type of treatment methodologies and technologies would work to eliminate cholera for sure in various situations. We know that activated sludge would do. As I just typed into the chat box, people traveling may import cholera to various contexts where sanitation systems are good. And this is a good enough barrier to avoid a spread. But now we have to really think of where the real vulnerability is. It's going through different regions in one country. It's going from one country to the next. How do we ensure that in a crisis, when there are refugee camps or IDP camps, that fecal sludge that will be generated, there's no way around it, will not lead to contamination of water resources, or it will not lead to staff working in the camp will get affected by the disease themselves, and so on. So we're trying, for example, to generate some traction around research on the efficiency of various treatment technologies, like, for example, we can think of chlorine to fecal sludge, or lime, how to make sure that contact time and concentration are ensuring that Vibrio cholerae will be eliminated, and then the risk of spread will be zero. So we're trying to put more attention on it. Of course, we are in competition with water, very clearly within our own sector. And of course, quick wins, you know, it's OCV, or oral cholera vaccine, has a lot of success, but limited capacity for production on a yearly basis. So we're trying to find an adequate balance between saving lives today and making sure that living conditions will improve for people living in vulnerable areas in the coming, let's say, 10 years.
Excellent. Yeah, no. I think, yeah, it's really interesting. We're coming towards the close of our panel, which makes me very sad because, honestly, I could listen to these guys forever. And I know for a fact there's a million things we haven't talked about. But perhaps my last question is sort of across the whole panel, and I'm going to start with Ibu Virji, is really, I just wonder if you could just leave us with if you think about leadership in government and leadership in the donor community, but government much more importantly, because that's where, huge majority of the investments are made and these decisions are made. What would from your position as a sort of experienced sanitation professional person, what do you want to say to government? Like, what is the one thing that we need to what's the message we need to be sending that could kind of really contribute to this shift? I'm going to ask you each of you 30 seconds. Ibu Virji.
Okay, so I have the shortest time to think. It's okay. So I'm the government actually, but my message, to the higher political leaders in Indonesia, maybe I want to put that way. So for Indonesia, in the context of Indonesia, maybe I can say more on that rather than on other contexts of other countries. So for Indonesia, what my message will be, of course, they need especially the highest political leaders in Indonesia. They need to be the leaders or to give examples for at least for the behavior change. They need to lead that behavior change, the change of behavior for the whole country. Because for Indonesia, the culture is we see the leaders. We always see the leaders, how they work, how they behave as well. We are what do you call it, patrilineal, still more on the patrilineal culture. So we see the leaders. We see the leaders. So they need to be the leads for this. Like India, I think the India for the open defecation free movement, the Swach Bharat movement, it was led by the Prime Minister himself. So they again, for the highest political leaders in Indonesia, not just at the national level, but also at the local, regional level, they need the one who needs to lead this movement as well.
Great. No, thank you. I love that. Right. So marching orders for the leadership. Professor Ahmed, super fast. If you could just say one thing to your bosses.
Just to combine these things together, water supply and sanitation and investment is needed together in both. So if we cannot protect the resources, if it's polluted due to poor sanitation, then we cannot supply the water. So it has to be, investment has to be combined together.
Great, thank you. Justine, a message for the world?
Well, I just would like to come back to one fact that we know that the return on investment on sanitation is even higher than the one on water supply, and to not forget that sanitation can be a very good business as water supply is.
Yeah, fantastic, thank you. And Kirsty?
Yeah, I think building on that, it's sort of more, South Africa has this motto, water is life, sanitation is dignity, but actually it has to be much more than that. It's of course it's more than dignity. So to try and actually think about water and sanitation and everything together all the time so that we're considering them as one whole water system.
Fantastic. Thank you so much. I'd just like to thank, on behalf of everybody, this amazing panel. I mean, I could talk to you guys all day. Fantastic insights. I get to hand back briefly to Juliet now, and just on behalf of everyone, I'm clapping. You won't be able to see everyone else, but thank you so much to the panel. Juliet.
Thank you, Barbara, and also thanks so much from me to our panelists for your insights. And it's great to be amongst a collective that cares about sanitation to work out how we can be a stronger united force on it. So I'd like to invite Guy Howard to provide us with some closing remarks. Guy Howard is a professor, he's a director at the Cabot Institute for the Environment and a global research chair in environmental and infrastructure resilience at Bristol. So over to you, Guy, to share with us some concluding remarks. Thank you.
Great. Thanks, Juliet. Thanks, Barbara, and thanks to all the wonderful panelists. I mean, I think my first reflection of this session is just the richness of what we've heard, and just the consistency with some of the key messages that keep coming through, which I think is something really important that we should take away. So these issues around how we deal with sanitation, how we link it with water, are things that we're all facing. We're facing in all the countries that are represented here, but also, as Barbara alluded to, these are problems that don't go away even when you're a high-income country. And certainly at the moment in the UK, we're facing major challenges and concerns around how we supply water and how we manage our sanitation. I suppose the big first takeaway I take from this session is actually, to answer the question that was posed in the title, is absolutely. I mean, if we are going to value water, we have to value sanitation. If you're going to have any hope of having any kind of safe water, whether it's for drinking, for recreational use, or for wider use, you have to have sanitation. It is the key preventative intervention that you have to make. And I think just taking time to reflect on that, I think in the past in the international development community, we've got very fixated on pit latrines and groundwater and trying to work out separation distances. But I'm really pleased that what came out through the presentations is actually the importance of surface water. And in fact, particularly in cities, that if you just pump out, tons and tons of shit into your surface water sources, you not only cause real problems for human health, you actually start to degrade that whole ecosystem, and you do much wider damage than you do just to human health. And you stop water being a critical resource that helps fuel economies and fuel societies. I think what was also really interesting coming out of the presentations is, we have the range of tools to look at this much more effectively. So we are able to use risk-based approaches. It's not new science. We've done lots of it before. What we need to be doing is doing more of it in practice, which I suppose leads to the big point, which I think all of you have spoken to, which is the problems around coordination, institutional capacity, and institutional development. And for me, this still seems the core problem. How do we get sanitation people, and not just water supply people, but people who deal with the water cycle, who manage water, to be working more effectively together? I was very struck by Kirsty's point that, sanitation seems to bounce around lots of different institutions and ministries, and no one really knows where it belongs to. And I think Martin very clearly highlighted the issue in Bangladesh, where you have so many players involved that mandates and coordination becomes very unclear. So I think if we have one really big message, is not just if you want to have safe water, you have to have safe sanitation. But to do that, you actually have to start working together, and you have to coordinate, and you need joined up planning. That needs, as I think Kirsty said, to extend just beyond, fecal management and drinking water supply. If you don't consider the entirety of what happens, drainage, solid waste management, you will not achieve these things. And we might say, well, in the end, why is this really important? Well, I think all the speakers have alluded to the health consequences of getting this wrong. Whether that's from Indonesia and Bangladesh, where people are talking about diarrhea and exposure to Justine, with the very, very cogent example of this is what happens when you get this stuff wrong. You get epidemics, and lots of children die, and they die very quickly and not very well. So I think we need to remember that the health implications of this failure to work together are really profound. So I think, when I look at that, I think, that is we need to keep on communicating that clear public health message. And back to politicians. I was really struck by the different approaches that people are talking about and how they're approaching. I love the example from Indonesia. That was fantastic. The use of social media, the use of new technology, the use of creative arts as a way of communicating something that we have all struggled to communicate effectively before, I think is really exciting. But we need to do more of that. And one of the things we need to do is, as much as we're trying to look at behavior change and promote individuals to change, I come back to, until we fix our institutions we will still have a problem. We cannot and should not just end up by saying it's individual households have to resolve this problem. It's much bigger than that. I feel like I'm not doing everything full justice because there was so much that was talked about today, but I am conscious on time. So I'm going to wrap up with, I suppose, just briefly saying, as we look forward to 2050, as we start to see as we become an increasingly urban species, if we don't start tackling now properly, integrating sanitation as part of how we manage our water resources, we will end up in a world where we are increasingly finding it difficult, not just to stay healthy, but our economies are going to start to slow down, and we will find a much wider range of environmental problems. So this is a very timely session, and perhaps the message back to Siwi is, please never just do a conference with the title of Valuing Water ever again. Make sure sanitation is there right up front. And with that, I'm going to hand back to Juliet.
Thanks so much, Guy. Couldn't have said it better. And the line I took away, it was actually from Justine. You said it's the solution because it's the root cause. And so, yeah, I'd like then just to thank all our speakers and panelists and moderators, and wish you well for your remaining time at Stockholm. I hope you take these messages home for yourself in your own work and the spheres in which you work and where you can influence to share this message. If you value water, then value sanitation. So thanks very much, everyone.